You're listening to the WCEG Network on WCEGtalkradio.com, the worldwide community empowerment group. Like us on Facebook, where we are streaming live. Follow us on Twitter or follow us on Instagram. Anyway, just listen to us today. We will be here for a couple of hours, and today our topic is on pregnancy. This is For Your Good. I'm Myrna Taylor Ransom. Bringing life into the world is truly a miracle. Although it seems so common, it's really quite unique. Think about how it happens. A man's sperm comes in contact with a woman's egg and fertilizes it. Then it forms an embryo that's microscopic in size and develops into a fetus with the characteristics of a human being inside of the woman. Unbelievable. This is our topic today. We're going to talk about pregnancy and healthy lifestyles while being pregnant. Our guest today is Dr. Janella Thomas Burse. And we have Dr. Charles So coming in as well, but he's running a little late. But welcome to our show.
Thank you. Thank you for having me. Again.
Yeah, right. She's becoming a regular on the show. When we talk about being pregnant, that just seems like, because so many people have babies.
So many.
Not me, but so many people have babies that you feel that it's a common sense kind of thing.
Right. We take it for granted.
Yeah, we do.
Like it's no big deal.
It's no big deal, but it really is.
It's a huge deal. A very huge deal.
And so we make a decision, or sometimes we don't make a decision to become pregnant. But when we are, then what actually happens?
Well, I think to back it up just a little bit, we do need to be conscious about whether or not we want to become pregnant. Yes, there are, like you said, sometimes we're not trying to, but it really should be a conscious decision because you are about to house a human being. You're about to house a human being, so you need your body to be in tip-top shape. So this program is about health. So it really starts with before getting pregnant, about health.
It should,
right?
Anyway.
It should start there before you're pregnant. I do have patients that will say, when you're doing their well woman exam and you're talking about contraception and they're not wanting any contraception, but they're not trying to get pregnant either. And my thing is, if you're doing what it takes to get pregnant, but not trying not to get pregnant, then you might as well say you're trying. The important thing about that is the mindset. Because if you're not making a conscious effort saying that, okay, I might get pregnant or I'm trying to get pregnant, then we don't do those things or stay away from those things that may harm that pregnancy.
Right.
We may drink the alcohol and we may, conception is, the very beginning is when everything happens.
Right.
It happens very quickly. The heart develops very quickly. The circulatory system, the heart. So even before you know you're pregnant, all that is happening. So you're not thinking about, well, I shouldn't really be drinking or I shouldn't be smoking or being around smoke and whatnot. So that's why I say
be
conscious about it. Be conscious about it because it's exactly, things are happening before you even are aware of the fact that you're pregnant. And then everybody's like scared because I did this and I did that. Well, it needs to be a conscious effort.
You can alleviate some of that stress.
Right. And nobody's perfect. We know that birth control can fail,
Yeah.
But if you're doing that, I mean, there's no, what can you say? But I just really encourage for us, everybody, everybody, to think about what we're doing.
Right. I'm reminded of that joke where the baby is supposedly born with the birth control pill in the hands. Oh, here, mommy, I think
I'm it.
It didn't work. Here I am.
Right. Really, so we think about with IUDs in particular, if there's a failure and the baby comes out.
Here I am, mommy. But pregnancy is really a complicated process, though, when you think about what really happens.
It's miraculous.
Yeah, it is.
Yes, it's complicated, but it's miraculous. And we're never, ever going to be able to really duplicate every aspect of a pregnancy. I mean, like you said, you started from a sperm and an egg.
Right.
A sperm and an egg gets together in that fallopian tube. It floats down into the uterus. And then, well, the miracle had already happened.
Right, right. And but this generally is a process of about 2 weeks, 2 to 3 weeks to become pregnant.
Well, you really only have about 72 hours in a month, really, to get pregnant.
Wow.
You know, if you think about it, it's really amazing that it happens
That is
so
amazing.
frequently. But, you know, because an egg only typically, now we're talking, things can go out of the average or out of what we typically see, but on average, one egg is released a month. Sometimes it can be more than one when people have a twin, or that egg can split into identical twins. But so we're talking the typical situation
Right.
where one egg is released a month, usually around what we call mid-cycle. So just to quickly go around, discuss our cycle, which a lot of women do not understand. When we say cycle, we mean from day one of your last period. So when we go to the doctor and they ask your last period, we really want day number one, the day it started.
Okay.
The day your period starts is day number one of your
Day number
cycle.
one. Okay.
And then it's just each day, 1, 2, 3, on average is 28.
Right.
So
right.
up until the next day one, that's how long your cycle is. Now, normal can range from 21 to 35 days.
Okay.
Average is 28 days, but that's just average. And some people are right at 28 days like clockwork, and some people are a little off. Some people think their period is irregular if it comes like on the first of one month, the third of another month. But it's not going to be, if it's 28 days, it's not going to be the same exact day of the month.
Right. Right.
But so I think that's important to know. And it's also important to know, people think, well, if I haven't had a period, I can't get pregnant. Well, you get pregnant before the period, right?
Yeah,
Comes.
I guess. Okay.
I mean, think about it. If you have a period, it's because you didn't get pregnant.
Right. That's true. That's
Right.
true.
So you have your period, and then the next one, if you miss it,
You're saying, uh-oh.
right. So,
Something has happened
really,
here.
But it's important to know that, so on average, again, we ovulate around day 14. So again, day one is the day your period starts. Your period may last 5 to 7 days. But then by day 14, not that you're bleeding that by then, but that's just part of your cycle. Not how long your period is, but how long your cycle is. And so on day 14, on average, again, let's stress on average, we ovulate or release that egg from the ovary.
Okay.
So that's, and then
Then
it goes
if it
into
comes
the tube. It comes into the tube, and if it comes in contact with some sperm, which only live for 72 hours.
Okay.
So if you are trying to get pregnant and you had sex 5 days ago and you ovulate 5 days later, you're probably not going to get pregnant.
You miss
right?
that period.
You're going to miss that egg. You miss that opportunity. So it's in the fallopian tube. The sperm and egg meet in the fallopian tube. And then this magic starts to happen. The miracle, God's work starts to happen. And that floats down into and implants into the uterus.
Wow. Now,
And
see,
then-
that is truly a miracle.
It's a miracle. Just look at us. We're here.
Yeah.
And we
By
started
that
as-
process.
Yeah. It's really a miracle.
That is
It's
really a
just-
miracle. And I'm going to jump the gun a little bit, but I have watched childbirth. And I mean, that thing,
It's a
I mean,
miracle.
I just cried so because I was so moved by the whole process of the baby being born. You know, so a whole life form comes out and looks like it's dead, and then all of a sudden you clear out the nasal passage, and then it's
Right.
it's a baby really crying, and it's a baby with all of the characteristics of a human being. You know?
And if you Google, you can Google what's called on call. It's EN and then CAUL. And that's
CAUL.
when, that's when the baby comes out still in the sac.
Oh, really?
Your bag of water is your sac, or technically your amnion and chorion membranes don't break doesn't usually happen because usually the pressure will make it break.
Make it break.
Sometimes you can get that, especially if you have a C-section. You can
Or
just
get the
not
baby
break
in the
them,
sack.
and the baby comes in this. I mean, and if you Google it, there was one time I saw it, and it was actually a video, and it actually showed the baby moving around in that sack.
Oh, wow.
You can Google it. It was really. I guess I shouldn't say Google because that's really a trade term, and you can look it up on the
But
internet.
that way people understand what you mean. Yeah, yeah. So implantation starts, that's when a pregnancy actually starts. The
Well,
fetus.
the pregnancy started in the
maybe.
tube,
Okay.
right?
When it met with the sperm.
That's where it started.
Okay.
It's gonna
And then
implant into the-
implantation takes place about a week after that, or.
a few days. It goes down there, not too long.
And then the embryo.
And it's dividing fast. So you have and then you have, which is a complicated process of the chromosomes coming together.
And separating into this and
Right,
that.
because, we have, so our chromosomes split in half. So we go from 46 to 23. The sperm has 23, the egg has 23. They come together. Miracle.
Yeah, it is.
They come together and they mix together, just to keep it simple, and that it starts dividing. There are different stages there's blastocysts and different kinds of stages of that embryo, those cells, those ball of cells that eventually differentiate into different body parts.
Now, the fertilized egg does not have to really attach itself at that point, but generally it does in the pregnancy.
Right, you hope it attaches in the uterus. Now, you do have abnormalities where it gets stuck in the tube, which is an ectopic pregnancy, which
And
is a
usually-
medical emergency.
So
we
usually
try
they
to,
would do with that one. They
well, it just depends on when you catch it. You hope that, which is the importance of early prenatal care, as early as you can, because if you catch it early enough, you can get medication to dissolve it. But if you don't, if you catch it too late, if that starts to grow in that tube, it doesn't have the room. The tube doesn't stretch like the uterus. So that tube ruptures, you could bleed to death.
Oh, wow.
Yeah, you could bleed to death, internal bleeding, bleed to death. So, very,
Then you have a problem then, right?
right.
Yeah. Okay. Now then, once this process happens, and we become pregnant. What happens, and how do you know that? You're not immediately ill?
No, not immediately, not during, but most of us, what do we go by? We go by what we can see or what we don't see. So if we don't see that period, then, and we need to not be in denial.
Right.
Because when we're not wanting this to happen, sometimes we're in denial. And, if you're doing what it takes to get pregnant, you don't have your period. Now, I'm not talking about people who have irregular periods. Your periods are all over the place, or you miss them. They don't come often.
Right.
But even then, you should need to know your body. But if you have periods and then you don't have one, then, every now and then we do get patients that come in and say, like they didn't know the obvious. But
Wait a minute. You know
denial,
something.
And in a way to deny, you have to kind of know it in your head what you're denying. But
Right. So you have some feeling anyway.
Right. So, but the pregnancy tests nowadays, the ones you buy in the store even, are so sensitive.
Really?
You don't even have to hardly have missed a period nowadays to get that positive test. They are so sensitive. And that's why, if you look at rates, they'll talk about miscarriage rates. They may be going up, but they're also being caught more because of our pregnancy tests being so sensitive nowadays. So, so it's, all I can keep saying is miracle.
Yeah.
Which is why you see why it's so important. We conceive around day 14 or so, average. Why it's so important not to have that alcohol around. Not to have that nicotine.
Alcohol can really impact.
Right, not to have that nicotine around.
Negatively.
Right. Not to even have the marijuana around. Nowadays, it's almost, even though it's not legal here, you would think it is. I mean, you can walk
Yeah.
anywhere and smell it, but and what's funny to me is when I'm taking a patient's history, and typically, yes, do you smoke? We're all thinking tobacco
We're all thinking cigarettes at that
but
point.
nowadays you really and you do ask for drug use, but before you even get to that, you're stopped because, well, how many packs of cigarettes do you smoke? Oh, I don't smoke cigarettes, I smoke marijuana.
Oh, okay.
People now, especially these young teens, early 20s, to them smoking is marijuana. It's not tobacco.
Right.
So you really
Right.
have to
You have to be specific.
specific, even though I would have gotten to it anyway when I asked about drug use.
Uh-huh.
But, they're not smoking cigarettes necessarily. They're smoking marijuana, though. But we just don't know. So something so important as a life, if you don't know, just don't do.
Right. So now, what happens once this? We've actually had the sperm come in contact with the egg now, and we discover something has happened, and their cells are dividing, and there is pregnancy. But what happens when there's more than one egg that's fertilized?
Then you have twins or triplets or quads. So you can get those a couple of ways, right? You can get
Right.
those because more than one egg is released at that
Mm-hmm.
time. Those would be fraternal twins.
Okay.
Fraternal meaning they're not identical, they're fraternal.
Mm-hmm.
Or you can have identical twins where one egg completely splits in two.
But why would it do
Or
that?
we don't know why that happens.
Wow.
Isn't that something? We don't really know why that kind of twin happens. And one important thing, a lot of times people will say, well, my twins aren't identical because the doctor said they were in two sacks. Well, if they're in two sacks, that doesn't mean they're not identical. If they're in one sack, they're definitely going to be identical. Okay. But if they're in two sacks, they could be fraternal because that was two different eggs.
Right.
But if they're identical, if that depends on at what point that egg splits. So if the earlier this is splits, means each one is going to have their own everything.
Okay.
Okay. But the later they split, the more they share. To the point where if they split too late, you have what? Conjoined or Siamese twins.
Yeah.
They're sharing a bit too much. Okay. So if they split late too, they can be both be in the same sack, which is scary because you prefer when we see twins, we're like, okay, how many sacks are there? Because if they're in two separate sacks, you don't have to worry about them getting entwined within each other.
Okay.
And things can happen with that. Things get
Right.
twisted. One twin can die,
Yeah.
So the cords could get caught up with each other. So it's much a little bit more relaxing for us if we see that it's
If
two
you
different
see
sacks.
two different sacks.
Right.
Because the chances of having normal.
Well, just it decreases your complications.
Okay.
Your complication risk if they are in their own house, so to speak.
Yeah,
So you kind of
okay.
can think of it as if my kids have two different rooms, they're not going to fight as much.
Yeah, I guess that's a good point. But if they're in two different sacks, do they still interact with each other in the
I mean,
womb?
they can feel each other. I'm sure,
Mm-hmm.
they're touching each other and whatnot, but they're not direct because that membrane, that sac is between them.
But generally when you see twins after they're born, they like to touch each other.
Because that's what they're used to being. They're used to
Wow.
being together.
Yeah. So that's a special kind of
Another
relationship.
miracle. Yeah.
But it's a special relationship that the babies have when they're twins and they've actually developed in the same womb.
Yeah, I'm sure it is. You hear stories about twins that have been separated, knowing that that something was missing.
Yeah.
And coming up Sunday night, I don't know if I can mention in a station
Go ahead.
on CNN, they're going to have a story about triplets that were separated at birth. And there's supposed to be a big catch to it. If you listen to the trailer about it, it looks really interesting. But it's 3 boys. They're identical triplets, which, you might as well play the lottery. They're identical triplets. They're grown men now, but they were separated at birth. Looks like they found each other early, but their story looks like it's going to be very interesting.
Yeah. That would be interesting to just see what actually
How they
happens,
felt.
how they felt. I mean, I wonder if they can recount any of
Right. Did
that.
they know something
Mm-hmm.
was missing? I don't know how old they were, if they were separated at birth, which it kind of alludes to that,
Mm-hmm.
that they were separated at birth, but I'm not sure.
And I actually looked at Twins, the movie Twins today with Arnold
Oh,
Schwarzenegger and
Danny DeVito.
Danny DeVito. And they were, you talk about fraternal
Fraternal,
twins.
yeah, obviously fraternal
Obviously
twins.
fraternal twins. Yeah, so
Right.
I tell you. Now when we talk about gestational age, what does that mean? That's
How far the
the
pregnancy is. And we
mhm,
always date it by your last period because that's the only thing we can objectively see,
mhm,
other than an ultrasound. But if you can, the best dating is by a sure last menstrual period, first day of
mhm,
the last menstrual period. If it correlates with that ultrasound, then, that's the best dating you can have. But being
mhm.
mindful, again, the pregnancy is actually 2 weeks older, right?
Right?
The pregnancy is actually 2 weeks older than that, but we date it that way. So 40 weeks is
40 weeks is the
from
usual
that,
from
from
that.
from your last menstrual period. So 40 weeks is the average. Some people deliver earlier. Some people may
Yeah.
deliver a little late. When I tell somebody their due date, I always stress, overly stress probably, that it is estimated because we get
Mhm.
that fixed and then we're like, whatever, when that date comes and goes. So I stress that it's estimated and that you could go past it. So you might want
Mhm.
to look at the dates past it. If you want to go a week and a half or so and focus on that date, you're going to have the baby at least by that date. But a week and a half to 2 weeks. But it is estimated. We just said what, this is a miracle.
Right, right,
Who makes the miracle? God makes the miracle. So
right, right.
we're not going to be able to know exactly when that baby's coming.
Baby's coming when he feels like
Right,
coming.
exactly.
Yeah.
Exactly.
So now we're talking about the gestational period being
On
what,
average, 40 weeks.
40
40 weeks
weeks.
is a full term.
So then they divide that into trimesters.
Divide that into trimesters. So it's not perfect, but usually around up to 13 weeks is the first trimester. Then up to
Okay.
about 26 weeks is the second trimester. And then after that's the third trimester. And then there's different testing that we do, depending on how many weeks or what your gestational age is, usually between 15 and 20. Well, your first visit, we're going to get all your prenatal labs. So let's start from there.
Okay.
So we get all your prenatal labs, which will include typically your blood type, your A, B, O, whether you're positive or negative, which we can
Okay.
talk about a little later. Um, that the majority of the population is O positive. Okay, so it includes your blood type. It'll include your blood count. So we can see if you're anemic or not.
Mhm.
It's very common for women to become anemic in pregnancy because our total volume, fluid volume, goes up in our vessels, but the actual red cell volume isn't increasing. So it's
Okay.
a what we call dilutional, meaning there's just more, like, I'm going to say water, but it's not water. More water serum than actual red blood cells.
Okay.
So we want the body to make more red blood cells. So that's why we give you iron. The body
Mhm.
needs iron to make red blood cells.
Mm.
But some women don't. Very few, though. Majority of women will become anemic if they're not taking the iron.
Mhm.
So it'll include that. Also include HIV testing, hepatitis B testing, syphilis testing. Unfortunately, syphilis is increasing again. It
Wow.
was going
Really?
down for a minute,
Again?
but it's increasing now. It's increasing now. Um, We also check your rubella status. So remember, rubella is one of those vaccines that we get. It's part of the MMR of
Right.
measles, mumps, rubella.
Mhm.
But we recheck that to see if you still have antibodies from your vaccine. And if you don't, you get it. You get another. We suggest rather another vaccination after the baby's born, since that's a live virus. You can't give that while you're pregnant. What we do recommend while you're pregnant, however, is the flu vaccine. Um, Obviously, when we're pregnant, our immune system is low because we don't want to fight the baby. So our immune
Right.
system is low. So if we get sick, it can be really bad. I mean, I remember I've seen women come in with a UTI, and if it can become from a bladder infection from in the bladder, to up to the kidneys really quick, and they end up in the ICU with intubated. I mean, and within hours.
Oh, really?
So it's really important that, which is why we advise the flu vaccine, because if you get the flu, you can get sick really, very, very deathly ill really quick. The other vaccine that we recommend is, and you get a flu vaccine anytime in the pregnancy. The other vaccine that we recommend is the pertussis or whooping cough vaccine. I don't know if you remember that commercial. I haven't seen it in a while, but I used to play it a lot. You can see the grandmother taking care of the baby, and she turns into a wolf, and she's coughing all on the baby.
Right.
Well, obviously, the purpose of giving the mom the pertussis or whooping cough vaccine in the last trimester, so that she builds antibodies and passes those on to the baby, so that the baby can be protected until the baby can get the vaccine. Okay. What else did we check for? We do with what we call a hemoglobinopathy profile, so to see whether or not you have sickle cell or sickle cell trait.
Right.
A lot of people don't know they have sickle cell trait.
Right. A lot of people don't.
We just don't know. So we do screen for that. And depending on your population, you might get screened for cystic fibrosis and other genetic disorders that are prevalent in a particular population. So in our population, it's sickle cell. Also there's hemoglobin C, which is another blood disorder too. So some people have C trait and they don't know they have C trait. So then it's important to know what the father is.
Yeah. So
right?
Yeah.
So if you have sickle cell trait, you need to know
what his status
is. And a lot of times, again, they don't know. So we offer to test the father too, because if you have trait and the father has trait, there's a 25% chance of the baby having sickle cell disease.
Right.
50% chance of the baby having sickle trait, and a 25% chance of the baby has normal hemoglobin.
Yeah.
So it's very important. So that's the whole sickle cell.
And sickle cell will take you out.
Yes. Which, not to get off topic, but that's one reason why, people kind of nervous about stem cell. But when we talk about the baby coming together and differentiating to our different body parts, the beginning of stem cells.
Right.
So if you can place a stem cell somewhere to develop what is normal, what is needed, what is lacking in a person. But like with everything, whether it's TV or that kind of technology, you always have to be careful whose hands it's in.
Right,
okay? Right. But there's good. There's good with that. So, but those are the basic things we screen for.
And that's during week 2 and 3.
As soon as you come in, your first visit.
Okay.
Like I said, the earliest the better, and most people come in a little later than that, but a lot of people try to get in around 6 weeks. We know you've missed a period, you've done a home pregnancy test, you know you're pregnant, so you're coming in to get get your prenatal care. And then we get an ultrasound and want to make sure that you're not having an ectopic, what we just talked about, stuck in the tube. And then we usually get another ultrasound at around 20 weeks. So I'm going to talk in weeks as far as gestation. 20 weeks, so we can see the anatomy. So, of course, most people are like, what am I having? But what we're looking at is the brain developing, is the heart developing, are the stomach, kidneys, all those all the limbs and fingers and toes. We're looking at that too, to make sure things are developing appropriately.
Now the embryo is developed now during weeks 5 and 6. You've got the little embryo. It's about a fifth of an inch long.
Right, and the heart is already there. We may not be able to see
that?
it. Yeah. We may be able, the heart, I think, develops around 20 days or so. You may not be able, you can't see it on the ultrasound.
Yeah. But before you at that point,
it's beating.
It's beating?
When you're talking the embryo at 5 to 6 weeks, it's beating. And sometimes on ultrasound you can see that at 6 weeks. You can see that through what we call the transvaginal ultrasound probe, where you put the probe not on the abdomen but in the vagina, and there's a probe. You can usually see at 6 weeks the baby's heartbeat.
Wow.
At 6 weeks. So those billboards are telling the truth.
Yeah,
those billboards where
really.
they're talking about to try to dissuade abortion, but it's the truth. The circulatory system has to develop first for everything to develop.
A very basic beating heart and circulatory system develop during weeks 5 and 6.
They're already developed.
Wow.
Because if you think about it, the important things have to develop
first.
Right.
Right.
Everything needs blood.
Yeah.
An organ or body part is not going to develop unless it has blood flow.
Right.
So you have
Buds for arms and legs.
buds, yep. So those pictures, and one other thing I always advise, technology is great, and there are so many apps out there that show you like, okay, oh, I'm 5 weeks, or I'm 12 weeks, what's my baby looking like? And you can see that, on these apps or Google it or whatever, and what's developed, what's part body organ is developing, and what tests to expect when you come into the office. What to expect when you come into the office.
The tail. What is the tail? The bud of a tail starts developing during weeks 5 and 6.
So what would you think?
The tail.
Just your tail, your butt. So you have your sacrum, which is goes into the coccyx. That's the bottom part of your spine.
This is all just too unbelievable. So the umbilical cord is developing then too. Then we move on to weeks 7 and 8. The embryo is now 1/4 to a 1/2 inch long. I mean,
Right.
we're talking like a little pea.
Right.
Wow.
Right.
Now the heart has formed. Webbed fingers and toes began to develop.
Right. So that means it's tissue between the fingers.
Okay.
So there, you may not be able to delineate. You can delineate the structure, but it's webbed.
Yeah.
Kind of like you have a mitten on.
The arms bend at the elbows. External ears, eyes, eyelids, liver, and upper lip begin forming in weeks 7 and 8.
You should have done a PowerPoint.
Yeah, I know. We
I didn't
really
think about that.
So we can actually have pictures, huh?
Yeah.
Then the sex organs are the same.
Right. We haven't differentiated yet.
So you don't know it's neither
differentiated
female nor male in all embryos until the 7th or 8th week.
Right. And we can't tell that. So now, people may go to their doctor the next appointment and say, can't you tell what I'm having? No, we still can't see it.
No,
like you said, it's an inch. You still can't tell what it is, what you're having yet, unless we do some kind of genetic
all of that
testing.
is less than, it's like a 1/2 inch long. So we're
Right.
talking half a tip of your finger.
Right.
So no, you can't really tell what it's
Unless
looking
you
like.
do genetic testing.
Yeah.
Which there are indications for genetic testing, pretty much, especially with age. Although 35 isn't old, in pregnancy world, it's called advanced maternal age. If you're going to deliver, if the baby's going to be delivered, if you will be 35 when the baby's delivered, it's considered advanced maternal age.
Right.
And so there is increased risk, even though the majority of genetic chromosomal problems are in women younger, but you are at increased risk of having that. And what women have to realize is our eggs are older than we are.
Right.
Our eggs are older. Well, our whole body's older than we are because our eggs are developed when we're in utero inside our mom. But we only date ourselves by age is when we're out of the mom, when we're born.
Right.
That's our.
So that means
really a second birth.
That's why it's so complicated to get pregnant at an older age.
Men sperm is not. It's brand new. They produce brand new sperm.
Now that's quite unfortunate.
Right. I guess because they have to do millions and billions and trillions of them over a lifetime.
Well, that's because they do anyway. Don't get me started, right?
Don't get Myrna started. But yeah, so our eggs are older than we are. So they're not 35-year-old eggs. They're almost 36 year old eggs. So
they've been there for a minute.
And therefore too, they have been exposed probably to whatever you've been exposed to all those years.
Right.
So they are increased risk of having chromosomal issues and increased risk of miscarriage. And usually by the time we get older, we have health problems that we didn't have when we were younger. Right. So that complicates the pregnancy.
Wow. Now we're down to 2 months now. So what's going on now in our bodies? Let's see. We're feeling uncomfortable. we're feeling discomforts.
Yeah, and we're not going to say everybody, because we do have patients who don't get the breast tenderness, don't get the nausea and vomiting, but the majority will feel at least some nausea, some amount of nausea. All those your hormones are high. Your body is, if you're just thinking about what you just described, that's happening to the fetus.
Right, right.
Our body is housing that, so our body's going through changes, allowing that to happen. So most of us are kind of sick, or it's not unusual for the women to lose weight the first trimester.
Lose weight.
Right, lose weight the first trimester because you don't have an appetite, and or you're throwing up. You can't tolerate food very well, and sometimes that can get very bad. It's called hyperemesis gravidarum. So you're hyperemesis, you're throwing up a lot, and gravidarum is just you're pregnant. So you're pregnant. So sometimes women have to be hospitalized for that.
So it's not just if you're eating, when you eat, you get sick. Some
women can't even drink any liquids.
Oh, wow.
They can't tolerate anything. Unfortunately, it does resolve, but occasionally fortunately, very rarely, we have patients that continue have it really bad throughout their whole pregnancy. But for most women, it will get better. Most women don't have it to that degree, but but quite a few women do end up going to the hospital, getting some IV fluids and going home. But once in a blue moon, we will have to admit somebody because they just can't tolerate anything. Some people can't even swallow their own saliva.
Oh my God.
I don't know if you've ever seen a pregnant woman walking around with you probably don't know it because you think she just has a Coke can or something. But she's really using that to spit in it because she can't even swallow.
And then the extra urination.
Just the pregnancy, some women, just like I was saying, that some women have the, vomiting and some don't. Some have that. They just can't.
Extra urinating.
Well, as you get bigger, it's right on your bladder. So your uterus is like right on top of that bladder, pressing on that bladder. So anytime a little bit of urine gets in it, you're going to know it's there.
Wow.
So,
now the sex organs, at 3 months, the sex organs are beginning to develop now.
Right. And I will say again, we can't see it on ultrasound, people, because people expect us to be able to see it. You can't see it.
Be able to see it. You can't really see that
right. Not at 3 months.
All right. Now we're moving on. Weeks 9 and 10. The embryo develops into a fetus. So now it's a fetus. 1 to 1.5 inches long. So we're still
very long.
Wow. Fingers and toes are growing longer. The tail disappears. The tail disappears. So now we're talking the fetus. The umbilical cord connects the abdomen of the fetus to the placenta.
So the placenta has developed now.
Okay.
So prior to that, though, you had what's called the corpus luteum cyst on your ovaries.
Okay.
So that corpus luteum cyst is where that egg was released from.
Okay.
So I also explain to people when they come in kind of upset, I have a cyst on my ovary. Well, the majority of cysts are what we call functional or physiological cysts.
Okay.
They belong there because you develop the egg, you release that egg, that sac closes up from where that egg was released, and it's a corpus luteum cyst that stays there, releasing progesterone to maintain that pregnancy until that placenta, until 4 months or so to the placenta. 3 months or so till the placenta is developed enough to take over and maintain that pregnancy.
So in weeks 11 and 12, the fetus is now measured from the top of his head to its buttocks.
That was the tail.
That was the tail. And now it's still just 2 to 3 inches long. That's still tiny.
Very.
But the fingers and toes are developed.
All this is developed. It may be tiny,
but it's there. Oh, wow.
But it's developed.
Now bones are beginning to harden.
Bones are hardening.
Skin and fingernails began to grow at 11 and 12 weeks.
And now also with technology, it's so, with the 3D ultrasound and whatnot, you can see things a whole lot better.
Oh, wow. Changes triggered by hormones begin to make external sex organs appear. Here we go, folks. Now you can tell. Kinda.
Um,
11 to 12
it's
weeks.
still hard to see by ultrasound.
Yeah. Okay.
Yeah, it's
Okay.
still hard to see, really hard to see by ultrasound. We're more comfortable with saying it between 18 and 20 weeks
Okay. Yeah.
because we definitely don't want to think what we see is not what we see, and then people aren't happy that they're thinking they have one gender and it's not.
But now the fetus is beginning to make movements.
Oh yeah, it's been moving. It's been moving when it was an embryo.
Oh, really?
It's been moving when it was
Because there is life.
If you do an ultrasound, yeah, you can, the early ultrasounds at 7 weeks or so, you can see it bopping around and kind of just.
That's when you know it's going to be trouble.
Right? From the beginning.
Right.
But it's probably at this point starting to have finer movement.
Okay.
Like bending the fingers and.
Sweat glands appear. Kidneys start making urine.
So what makes the amniotic fluid? That bag of that water that breaks. It's your baby's urine. It's the baby's
eyelids are fused together. Wow. This is just truly amazing. Well, just because it's amazing to me is just because I've never had one.
It's amazing to me.
And you had a few.
I mean, I've had them and I've delivered them, so it's still amazing. I don't think you should ever, even though you might see it all the time, you can't forget how amazing and the miracle that it is that's happening.
Wow. Now, this my information says that you probably won't gain much weight during the first 3 months of pregnancy.
That's the first trimester. A lot of people lose weight.
A
lot of people lose weight because they're not. You don't feel good.
Right.
Now, some women, that's not everybody. So again, I keep saying we're talking on average because I know how we are. If you're listening, you're saying, "What didn't happen to me?" Okay, but on average, most of us, we don't feel good. Can't eat much of anything. There's certain things that you can eat more than others, but you're probably throwing up and whatnot. So it can happen anytime during the day. We call it morning sickness, but it can happen anytime.
Okay.
So I usually advise people, if you know what you can tolerate, eat that.
Right.
Okay. It may, even if it's pizza, it's still some nutrition in it. It's better than nothing.
Right.
Definitely advise staying hydrated because we can do without food much longer than we can do without fluids. I mean, we can do without, Okay, so you can do without food for a long time, but you can't do without fluids. Your body has to have fluids.
Okay.
So stay hydrated. If you can tolerate the Gatorade or Powerade, to get some electrolytes, or coconut water has electrolytes in it.
Oh, yeah. I would be good with that.
Yeah, you always have a bottle of coconut water. But to stay hydrated and keep your electrolytes there.
Right,
because otherwise, if you get dehydrated, you'll end up in the emergency room, get an IV to get hydrated, hopefully be able to go home with some medication. What I advise, too, is if you can control it without the medication with ginger. So I don't mean like sugary ginger ale. I mean like ginger tea. I had one patient, she actually nibbled on a ginger root that helped her. So ginger does help. Vitamin B6 complex helps. So if you can do those things that can help you get over this hump, that's better. If you cannot, then there are medications we can prescribe that will not harm the baby, that will help you. So a lot of the women end up being on something till they get past this, which is usually around 13, 14 weeks.
Right. Now, during this time, the 3 months, that first trimester, that's generally where a lot of miscarriages happen.
Correct. A lot of miscarriages. Estimated about 40 to 50% of pregnancies miscarry. The majority before we even know we're pregnant. You may just have a regular period. It may come right at the same time, maybe a little bit late, but you're not really thinking about it. Maybe a little bit heavier. And that's possibly a miscarriage that's happened. Because again, like I said, you don't even really know you're pregnant yet. But some do happen later. It's less likely to happen once you see the heartbeat there. But it still could happen. The majority of time, when they've done studies on the tissue, there usually is some kind of chromosomal genetic problem that's in that embryo. Now, that doesn't mean that you have a genetic problem. It just means that the way I describe it is, out of the trillions of conceptions that occur, and when those chromosomes mix and things start happening, everything doesn't happen just right all the time.
Right.
And the majority of those will miscarry. Now, sometimes we see chromosomal abnormalities. We see Down syndrome and other kind of syndromes.
Oh, you can see that at that point?
Well, no, I mean when people are here.
Okay.
We can, we know that's a chromosomal abnormality,
Okay.
but the majority will miscarry, are not compatible with life.
Okay.
So they will miscarry. So I try to, tell people that, because we blame ourselves. And
Right.
the majority, and sometimes there may be something that we did, but the majority of the time it's not. I mean, if you're doing drugs and whatnot, that will increase your risk of it.
Okay.
But the majority of the time it's nothing that we did. It's
Nothing.
just something that happened.
It just happened.
It's just something that's happened.
All right. Now we're down to week 13 and 14.
Week 13 and 14.
As the hair begins to grow, prostate gland begins to develop in the male fetus. Ovaries
So now we
move
know
down.
there's testosterone present, right?
Always.
Well, I mean, there's some to differentiate that fetus.
Yeah. Right. Okay. So now we've got ovaries moving down from the abdomen to the pelvic area.
Because everything, and
And a
all our
female
organs,
fetus?
all of our organs don't start where they are now after we're born.
Right.
So we see that in men more so, because sometimes those testicles don't drop down sometimes after they're born.
Well, I know they
But
don't
the
in
women-
puppies. They don't in male puppies.
Right.
Sometimes they, don't drop at
Right,
all. I had
right.
a puppy that I had to take to the doctor, and the doctor said the puppy's testicles didn't drop.
Yeah.
And it was, they ended up becoming cancerous because they
They
stayed
were in the wrong place.
They were in the wrong
Right.
place, right?
So so our ovaries do that, but they come down like you were saying.
Yeah.
While we're a fetus,
And
they
the
come down in the
root,
right place.
the roof of the mouth is then formed.
So
Wow.
the roof of the mouth. So that's where, if there's any if it doesn't form correctly, you can get the cleft palate, cleft lip,
Yeah. Okay.
which
Yeah.
isn't, unfortunately, it's sad when you see countries that shun those kids, but it's nothing. It can be bad if it's large and make it difficult for them to eat, obviously.
But they can
it
be operated.
fixed.
Yeah, it can be operated
fixed.
on.
And thank
Yeah.
God for those doctors who go to those places and fix them.
Now, the biological sex of the fetus can sometimes be seen around weeks 13 and 14.
Sometimes, but we're really not comfortable to, if I say, well, I think it may be a boy,
Right.
but let's be sure in a few more weeks.
Yeah.
Okay.
Okay. Now, we have a caller that wants to know what causes two sex organs to develop.
Well, when we have these malformations, a lot of times we don't really know why they're happening. So I'm assuming when you mean two sex organs, you mean they have male and female sex organs. So we don't really, obviously it happens during that differentiation period of time. But what exactly is happening to cause that, we're not sure of.
Yeah.
But we know when it's happening.
And we do know it does happen.
And it
sometimes.
does happen. Which is why, when you're talking, if you're saying to tell somebody what they're having at 13 weeks, suppose a female fetus has a large clitoris. If you have a large clitoris, you might mistake that for a penis. So, it's the same. It's the same. It began in the same place. Clitoris and penis is the same. Ovaries, testicles come from the same. So,
it's just an abnormality that happens at that point sometimes.
Correct. And sometimes it's genetic for some people,
Wow. But that's amazing that during weeks 15 and 16 that the ovaries develop in a fetus. That is just unbelievable.
Right.
So that means your eggs in a woman of when you're born.
That's what I'm saying. They're older.
A lot older.
Right.
That's
Right.
almost
That's why I said
2
we're
years.
older than what we are.
Yeah, that's actually 2 years
We're
older.
9 months older than what we are.
Yeah, at
40
least
weeks
9
older,
months.
Yeah, about 40 weeks on average older than what we are. Right? 40 weeks is almost a whole nother year.
That's that could be why
Right.
we're more intelligent, because we're
Because our
actually
eggs are
older. Right. Okay, now we're moving right along. We're in our 4th month. Nausea usually lessens.
Right.
That's
So
a
usually
good
around
thing.
13, 14 weeks, nausea lessens, people's
But
appetite starts to pick up, and then the weight starts to pick up.
But then heartburn and constipation may be prevalent.
That could be.
Okay.
And you could have had the heartburn though when you were throwing up a lot too in the first trimester.
Yeah.
But
Okay.
you can take if you're having the heartburn, you can take Tums,
Yeah.
Rolaids. Those are okay to take in pregnancy.
Okay.
Mylanta, Mylox. Those
Okay.
things are okay.
They had acids and things like that. But now the increased blood flow may lead to bleeding gums, nosebleeds, nausea. I mean, nasal stuffiness.
Yeah, some people get nosebleeds from that because you have more blood flow obviously to your uterus, but you have more blood flow everywhere.
At that point.
Okay. All over your body. That's why you see pregnant women, their veins are usually big, easier to draw their blood. So you have increased blood flow everywhere. So you can definitely get nosebleeds. And it's important too to keep your air moist. So you might need a humidifier that might help, because a lot of women complain of it being dry too, especially this time of year.
Yeah. Okay, 5 months now, and your fetus develops soft body hair.
Yeah, you can see the little fuzziness. What's important too, at about now, between that 4 to 5.5 months, we do a test called a quad screen. Okay, the quad screen, it tests. We draw your blood. It tests the baby's risk of having a chromosomal abnormality, such as Down syndrome, which is 3 chromosome 21s or 3 chromosome 18s, and it also tests the baby's risk of having what's called spina bifida. We call it neural tube defect, but when you were talking about that neural tube early, if there's a malformation there that is not closed up, there's a part that's open, so anywhere from the brain to the bottom of your spinal cord, that's called a neural tube defect. And so we test the baby's risk. The test doesn't say the baby has it or not. It gives a risk ratio. So if you are, let's say you are 26, and the average 26-year-old risk may be 1 in 1,000. If your test comes back 1 in 300, then that's a high risk.
Okay.
So then further testing would be offered. And that could be for the blood test nowadays, which is relatively new, that they can draw your blood, get the baby's cells out of it to see and do the chromosomes on those. Or they may offer an amniocentesis, which is getting some fluid from around the baby to get the cells. If you're early, and we kind of missed over that, discussing if you're that advanced maternal age, early in the pregnancy, they may offer what's called chorionic villus sampling, which is going in and getting some of the tissue around where the baby is, and get the whole thing is to get some chromosomes from the baby, so we can test the baby's chromosomes. Okay.
And you can determine then if there's any abnormalities.
Right. So we do that between 15 and 20 weeks.
All right. Okay. So now, at 20 weeks, the baby is what, 6 inches long? That's okay. Let's see, a little bit longer than my finger here.
Yeah.
So that's pretty good now. So we're 5 months pregnant now. We're walking it down, folks. Walking it down. Then the 5th month, let's see. You may feel flutters or butterflies in your stomach. The
little quivers down at the bottom.
Baby's moving around a little bit.
But you're not feeling a big swift kick yet.
Oh, okay.
Obviously, you said it's only 6 inches, so you're not feeling that big swift kick.
But 5 months, that's halfway there. 6 months, let's go on to 6 months. The fetus is about 7 inches long now. Okay. Fetus is about 7 inches long now. Bone marrow starts making blood cells. Taste buds begin. Taste buds.
Right. So I mean, you can imagine how they find these things out, those kind of things out.
No,
If you have a miscarriage, and you have to examine the tissue.
Oh yeah, okay.
That's the only way they're going to find out taste buds. you know.
That's amazing. This is just truly amazing to me. I've never really thought about each week's development during each week. The fetus now at 23 to 24 weeks. We're about halfway there. We're about to get there.
A little bit more than half now.
A little bit more than half. Okay. Eyebrows and eyelashes develop. The baby's 8 inches long now.
8 inches.
Mm-hmm.
So you see why if somebody delivers that early,
right?
Well, you can't. I mean, 20 weeks you can't really do anything, but the 23, 24, 25 week babies, when they're born, they try everything they can, and some of those babies
can survive.
But imagine how small the instruments have to be.
Oh yeah.
If you intubate a baby, put a breathing tube down, those things are really, really tiny.
Yeah. Braxton Hicks contractions. What's that?
So that means the uterus is contracting. The uterus is just a big muscle. It's a big muscle, and it starts to contract, but it's not labor.
Okay.
It's not causing your cervix to soften and start to open and whatnot, but it's getting stretched more. So when you stretch something more, there's, that I like to think of as that for every action, there's an equal and opposite reaction. So it's kind of squeezing down, but not enough to do anything. And we hope that doesn't happen. But we do see that.
Right.
Preterm labor, preterm delivery.
Yeah. Now we're in our 7th month of pregnancy. And
7 months, so we're about 28 weeks. So now the next test we do is the screening test for diabetes in pregnancy. Because pregnancy can increase your risk of diabetes while you're pregnant. For most women, it will go away after they deliver if they are diabetic.
Okay.
But I always tell them, whatever we're teaching you with the diabetes while you're pregnant is the way you need to try to continue to eat, because you're at 50% risk of becoming diabetic as you get older. So you're at high risk of becoming diabetic. Get a hold of it now. And especially if you're having a baby, raise your children with healthy eating. I know we talk about healthy eating a lot on this show. So, I have a lot of patients, they'll say, well, I'm fixing this for me, but I fix whatever for the rest of the family. I'm like, no, everybody needs to eat that way. So you don't want them to have that same issue. Now, people who have a high risk of diabetes, family history, or they had a prior pregnancy where they were diabetic, then we will do that test early. When they come in, we'll do that test early to make sure that we can catch them. Maybe they are a frank diabetic, type 2 diabetic. So we want to catch those as early as we can. And if that's normal, they be still repeated at this 24 to 28 week time. Okay. So that's the time we do that. We offer the Tdap, which is the pertussis vaccine. And all along with visits, we're starting to, at 28 weeks, we start to see you more often. So at first, we were seeing you every 4 weeks. Right. We're seeing you every 4 weeks. When you come in, once you get to a point where we can hear the heartbeat, depending on what kind of Doppler you have, you should be able to start hearing that around 11, 12 weeks to hear the heartbeat. And so we'll do that every time you come in, and we measure your uterus. And that measure of the uterus is a gauge of how that baby's growing. And so now after 28 weeks, we start seeing you every 2 weeks. So then it's getting closer. It's getting closer. And we're down to now month 7. So we're going to take a short break here, and then we're going to come back to this part really gets serious now because the baby's almost here. We're going to talk about that and other things related to pregnancy and our healthy lifestyles. You're listening to For Your Good on the WCEG network on WCEGtalkradio.com. I'm Myrna Taylor Ransom, and our guest today, our medical expert today, is our OBGYN. That's Dr. Janella Thomas Burse. We're going to take a quick break. If you all have any questions, any comments you want to add to our conversation today, we would love to hear from you. We'll be right back in a short.